3D movies have a new dimension, and that new dimension is protecting eye health.
We believe that 3D viewing is a good screener for underlying vision problems.
Basically, if we look at the nation now, and we look at how children get to care, we can see that they pretty much don't get to care.
That the focus is going to be on the human factors, the comfort, and the safety in the use of 3D.
What can we do to test individual eyes to determine if that person sitting in the exam chair is at risk for the types of symptoms that are being experienced?
Vision screening is done by the pediatrician or school nurse. Guess what they use? Snellen eye chart, right? You've all seen those, okay? 27% sensitivity. If I told you that I was going to use a test with 27% sensitivity, you would laugh at me. That means that most of the kids being tested are being told that they don't have a problem. And what happens is they can't maintain focus, they can't read, they can't comprehend well what they're doing, and they fall behind. But the parents don't think about vision as the problem because they were told that their child passed the vision screening test. 80% of learning is related to vision.
First, we have a lack of education. We have people that don't understand what 3D is. They don't understand that reality is 3D as well. Once we start to address the concerns that people have, the issues we might have around 3D, all of a sudden now we're moving forward.
One of the efforts that we're taking on initially is a 3D in the classroom guidelines. This is a document and assistance for teachers around the country who are using 3D already in their plans and who might be looking to it in the future. It's an awesome way to teach math and science.
We talk about the high rates of false negatives and the impact that those false negatives have. If a child is screened with an insensitive test and they're told they don't have a problem, they take that problem, they carry that along with them as an anchor throughout their lives.
What we're doing is we're collaborating on ways to enhance the quality of life. And if the same vision issues that create uncomfortable 3D can be traced back to attention of our children in school, this makes all this work extremely important. And that's why we're so excited about being part of this.
People with learning disabilities, they're quote-unquote labeled earlier in life. A lot of the people who are juvenile delinquents, unfortunately, we have a detention center that brings patients over week to week, and guess what? They have undiagnosed vision problems. Not all the time, but a high proportion than what we see in day-to-day practice life.
Step one is getting people to have their eyes checked. Step two is finding creative ways using technology to fix, train, and help people see reality better.
As representing right now what you could think of as a perfect storm. A confluence of science, technology, invention, application, new ways of seeing the world, new ways of looking at the world, and market opportunities. 3D and stereoscopy and stereogrammetry and stereography have been quietly revolutionizing science, technology, industry, medicine, education, and a number of other areas. There really is no limit to what 3D as a tool can offer science and technology.
The essence of the message is that we have come together to empower the American people with new information about the importance of eye health and the importance of comprehensive eye exams.
During my tenure as the AOA president over the last several months, I've had the opportunity to see many exciting things happen in our profession. 3D is moving quickly into the home with televisions, home health gaming devices, and even more, as you've heard this afternoon. It's estimated that anywhere between 3 to 9 million people have problems with binocular vision prohibiting them from watching 3D technology.
There was a stereophotographer who's been noting that for the 20 years of his career, many times he presents a stereo image to someone, and they quickly note that they can't appreciate it. And he said for this whole time, this whole 20 years of his life, he said, that happens sometimes. From this day forward, he now has something to say. He's going to point out to that individual is the fact that it is most likely you have a treatable vision condition. We're going to be particularly looking for those moments, those teachable moments, where we can point out to the American public that symptoms associated with 3D viewing could very well be a blessing in disguise, in that it could trigger the most appropriate thing, which is getting a comprehensive eye exam.
It's our goal with this partnership between the AOA and the consortium will hopefully help and improve the understanding of 3D viewing as a safe and appropriate technology for all viewing audiences. We're looking very forward to this partnership here, and also helping people experience the 3D experience to the best of their ability. Thank you very much.